Welcome back. It is 9:12. Just when we thought we were putting this pandemic behind us, some officials are now issuing new mask guidance. That's because of the growing concern over the rapid spread of that Delta variant. The more dangerous and more transmissible variant has spread to almost every state in the United States. And joining me now to weigh in on this and other issues is Dr. David Zich with Northwestern Medicine. Good morning, Dr. Zich. This variant, it's expected to become the dominant strain in the U.S. And with half of the population still not fully vaccinated, there's concerns it could cause a resurgence in the fall. How likely do you think that is to happen?
Well, it depends on a number of factors. And yes, we are seeing a tremendous resurgence over in the UK, and the United States traditionally has trailed behind the UK by a month or two. So we see this coming. The issue is all dependent on how our vaccination rates go. So already we're seeing some resurgence, as you mentioned, in parts of the country that have low vaccination rates. For instance, Arkansas, one of the lowest vaccination rates in the country, has had a resurgence just in this last week, causing some hospitals to have to reopen their COVID units. It all depends on the vaccine, though. We know that Pfizer and Moderna actually protect quite well against the Delta variant. In fact, it reduces your chance of getting flu symptoms by about 80 to 90%. Johnson & Johnson, not as much, but still fairly effective at reducing it by about 60%. And all the vaccines seem to reduce the chance of major illness, hospitalization, and death quite significantly. The problem is if you've only received one vaccine of the two for Moderna and Pfizer, that goes down to about a 30 to 34% reduction, which is not great. So if people get vaccinated by the fall, we're going to see very low levels. In those areas that have a low vaccination rate this fall, we're going to see a lot of illness and a lot more death.
Okay, let's go back to what you were talking about, how we tend to follow Europe, and the UK had some problems. What's the vaccination rate like in Europe? Is that why the variant was taking over there, because their vaccination rate was actually lower than ours here in the United States?
So in the areas that have low vaccination rates in the UK, yes, they're seeing a significant outbreak. We are seeing increased illness even in people that are fully vaccinated, but these tend to be low levels of illness, and their transmissibility, we think, is a lot less.
Okay, so let's talk about masks now, because some states have now reinstated mask guidance for the upcoming school year. Governor Pritzker just started urging everyone to wear a mask indoors because of the Delta variant. Where do you stand on this?
Well, again, people who have been fully vaccinated should have very little to worry about whether they have a mask or not. The problem is, for instance, school children, many of them aren't even eligible for the vaccine yet, and a lot of the kids have not gotten vaccinated, so that's a little different story. Then, when you have areas of mixed vaccinated and unvaccinated, we found it fairly difficult to enforce masks only for the unvaccinated. And as public policy, if we see a resurgence in the Delta variant, I think going back to masks for everybody might be a necessity to try to keep this under control in public settings.
Okay, so let's talk about children, those under 12 that cannot get vaccinated just yet. How do parents protect them and make sure that they don't come down with this?
A lot of it is repeating what we've been talking about for the last year, trying to wash your hands, maintain distance, avoid big crowds, etc. Luckily, they seem to be at less risk for getting the virus, even without masks. But the schools also have to still maintain certain protections, and a lot of schools have gone to individual pods and units that keep people together instead of having them widespread. But there's a number of ways to mitigate the risk for the little kids so that they stay healthy.
Okay, let's talk about travel now, because the numbers are on the increase, and it's expected that this 4th of July holiday is going to be huge as far as the number of people traveling since this pandemic. What advice do you have for anybody who's going to be boarding an airplane this weekend?
These will obviously be individual decisions. If you're fully vaccinated, you can relax a little bit more, but I know many of my patients, and myself included, are still going to wear a mask when they're in close quarters with the airplanes. Another incentive is that I have just started seeing in the last couple weeks an explosion of really nasty cold viruses. Now that the masks are coming out, there are other illnesses out there, and these nasty cold viruses can really put a damper on your vacation plans. If you wear a mask on the airplane, you're going to decrease your chance of any illness, not just COVID.
You are so right about that. So your patients have been coming to you about cold issues, because a lot of people here have all of a sudden gotten sick, and they haven't gotten sick at all in a year and a half because. So another good reason to keep them on.
Right.
Okay, finally, also this week there was a new study that suggests that the 2-dose Pfizer vaccine could actually keep an immune response up for years for those who have taken it. Unlike the annual flu shot, I know more research needs to be done in this, but if it could last for years, how long are we possibly talking about?
It's a very good question. This all involves very complex details between the reaction of the immune system to the vaccine itself. It's very difficult to tease out. We know that some people that actually got the virus only had immunity for 2 to 3 months before getting sick again. But the vaccine appears to last a lot longer. You're right, the flu vaccine is really effective highly for about 6 months only. A tetanus shot lasts about 10 years, and the shingles vaccine is good for life. So we are still trying to figure out how long the COVID vaccine is going to be good for. We'll be monitoring that and updating things as data comes in.
Okay, Dr. David Zich, as always, appreciate your time. Have a great day. Talk to you soon.
Thank you.
And